Well, Namibia continues to face one of the world's highest rates of COVID-19 infections confirmed. The Delta variant is present in the country. The Delta variant was detected in 17 out of 18 samples analyzed. Now, Namibia recorded 4,795 coronavirus cases per million people over the last week, the highest rate globally for that period. Now, the executive director at the Ministry of Health and Social Services, Ben Nangombe, joins me via telephone for an update on these findings and an update on what's going on in terms of mitigating solutions. Good morning, Mr. Nangombe, and thank you very much for joining us.
Good morning, Elawa. Thank you for having me.
All right. Mr. Nangombe, please talk to us about the genome sequencing exercise that has been taking place over the past month in detecting the Delta variant. These were conducted by UNAM in collaboration with a research institute from Germany, right?
Yes, correct. Yeah, basically, in terms of context, the genome sequencing of Namibian COVID-19 samples has been going on since March this year. At first, the samples were sent to the National Institute of Communicable Disease in South Africa and also to the Robert Koch Institute in Germany for analysis. We then worked hard to develop genome sequencing capacity locally. And as reported in previous reports of genome sequencing for the month up to March, we had seen the documentation of the Alpha variant, which was detected in the UK, and the Beta virus in South Africa. We have now reported that Delta variant detected in India is now present in Namibia, as you pointed out, detected in 17 out of the 18 samples sequenced. These samples were taken from the Commerce region during the month of May and June. And, of course, we have had a high suspicion that the Delta variant is present in the country due to the epidemiological characteristics of this third wave. So it's for this reason that we opted to move quickly to do some testing of recent samples and document the presence of the Delta variant in the country.
Now, talk to us about some of the distinct characteristics of this specific variant.
The Delta variant is said before or it was identified in India, and this is reported to have caused their devastating second wave.
Yes.
And it has been shown to be 40 to 60% more transmissible than even the Alpha variant, which was shown to be 40% more transmissible than the original Wuhan strain. This is, as the scientists tell us, caused by a mutation of the spike protein, and this makes it more infectious. Now, just from the fact that the Delta variant is more infectious, means that more people will be able to be infected if they come in contact with an infected person, and this could lead to more potential deaths and hospitalization. So there is also some evidence that the Delta variant may also be more virulent and can lead to more deaths. So Namibians need to be careful going forward.
Now, Mr. Nangombe, India detected a Delta Plus variant. When will Namibia also be able to see whether this variant also is existing in our country? I mean, on the 23rd of June, this variant was also detected in 9 other countries apart from India.
Yeah, what is going to happen is that we will continue to conduct genome sequencing surveillance to collect specimens from different parts of the country, and also the continuous surveillance in the Commerce region in order to detect the different variants that may be circulating in Namibia. Of course, there are various variants of concern that can be pointed at, and that means there could be other variants that may arise. So for now in Namibia, going forward, our scientists are going to continue conducting genome sequencing to detect variants that may be present and circulating in Namibia.
All right. Now, Delta variant is clearly detected in Namibia. What happens next? What's the next phase?
As I indicated, we are going to conduct continuous detection and surveillance here in Commerce region where we have confirmed its presence. We are going to bring in more samples from other parts of the country to detect whether, to the extent to which the variants may be spread across the country. And in that fashion, we will be able to tell exactly to what extent the variant is present in other parts of the country.
Now, Mr. Nangombe, please elaborate on the enforcing mitigating efforts that the ministry is implementing in dealing with the outbreak of this specific variant.
Yeah, the Delta variant, like other strains of the COVID-19 virus, are transmitted basically in the same way.
Okay.
What we know is that the Delta variant is much more transmissible than the previous strains of COVID. It is therefore critical that the public observe all public health precautions like avoiding gatherings, proper use of masks, social distancing, hand hygiene, and proper ventilation. This virus is much more easier to catch. That is what we are being told by scientists. It's easier to catch from others, and if people gather together at this time without proper precautions, it is very likely that all, if not the majority of them, will end up being infected and spreading the virus further. Therefore, we advise the public to always observe the public restrictions even more closely and strictly than they have done before. Because, and that is because this virus is difficult to control in the sense that it is easier to catch, easier to spread. It can lead to new infections, new hospitalizations, and death. So we need to hold hands in order to do what is right.
Now, ED, is there any way, apart from the genome sequencing exercise, that one can detect whether they have this variant, for example, through symptoms? Can I tell whether the symptoms I have are specifically of a Delta variant? Is that possible?
I don't think it's possible for anybody to tell without laboratory confirmation the type of variant that may have caused the infection in an individual. So what needs to be done is for people to continue observing the protocols in order to protect themselves from infection, whether it is the Delta variant or any other variant. It's a corona infection, and corona is dangerous, and it can lead to hospitalization and death. But there's no way one can tell on the face of it without laboratory confirmation the kind of variant that the person may have.
Now, when these variants are detected, many people ask the question, do the vaccines that we currently have and that we are procuring, will they protect us from these variants?
The information at our disposal are showing that particularly the AstraZeneca vaccine is effective against the Delta variant.
Okay. All right. Now, ED, I would just like us, as we conclude this interview, for you to talk to us about the vaccines that we were due to expect at the beginning of July. We're currently on the 7th of July. Could you give us an update on that, please?
Yes, we are working very, very hard with the suppliers in order to get the vaccines here. The Sinopharm vaccine that we have ordered is likely to arrive in the next few days.
Okay.
We expect the J&J vaccine also to arrive soon. We are working with one of our development cooperation partners for 168,000 vaccines of the AstraZeneca also to come in the next few days. The unfortunate thing is that the suppliers would never give you a firm date on to say the vaccine is coming on this date. They will give you an indicative date, and the indicative date that we are getting that the vaccines should be coming very soon. So we look forward possibly to receiving some doses either towards the end of this week or early next week.
All right. Many thanks, Mr. Nangombe, for taking our time to speak to us this morning.
You are most welcome.
All right. Well, that was Ben Nangombe, the Executive Director in the Ministry of Health and Social Services, and he was just talking to us about the Delta variant. When we continue